All right, today we're putting on our detective hats. We're going to dive deep into a core technique in physical therapy called manual muscle testing. And we're going to uncover exactly how a therapist can solve the mystery of your pain or weakness using pretty much just their hands and their smarts.
I mean, have you ever really thought about that? You walk in with some vague pain, right? And they somehow manage to pinpoint the one specific culprit, the exact muscle that's just not pulling its weight. This isn't a lucky guess. Nope. It's a real investigation. And like any good detective story, it all starts with a mystery. So let's set the scene here. Your body, that's our crime scene. And that weak muscle, well, that's our culprit hiding in plain sight. So the big question is, how do we find it? We need a solid, reliable way to gather some clues.
And the number one tool in our detective's kit is manual muscle testing, or MMT for short. It's a totally hands-on procedure where a therapist figures out a muscle's strength by testing it against two main opponents. First, the constant, relentless pull of gravity, and second, the very specific resistance from their own hands.
And listen, this is way more than just a simple push against my hand test. It takes some serious skill. A really good therapist has to be a super keen observer, right? They're looking for the tiniest flicker of a muscle contracting, and they have to spot when the body tries to, cheat by using other muscles to help out. They're after the truth of the movement, not just the movement itself.
So why even go through all this trouble? Well, because the stakes are pretty high. This test lets a therapist find that one true weak link, which means they can build a super focused treatment plan instead of just a general one. And it's not just for the initial diagnosis, it's how they track your progress over time and even stop future injuries by catching these little imbalances before they turn into huge problems.
Okay, so before any detective can start questioning suspects, they have to understand the language they speak, right? And for muscles, that means getting the basics of how they actually work.
So let's break down how muscles talk. Just picture a simple bicep curl. That lifting part, where the muscle gets shorter and bunches up, that's what we call a concentric contraction. But the lowering part is just as critical. That's an eccentric contraction. See, the muscle is actually getting longer, but it's still under tension, controlling the weight. A weakness in either one of those is a major, major clue.
And you gotta remember, movement is never a one muscle show. You've got the agonist, that's the star, the one doing the main work. Then there's the antagonist, the muscle on the opposite side that has to chill out and control things. And of course, you have the synergists. They're like the essential supporting cast, helping to stabilize the joint so the star can do its job right.
Now for a bit of a trickier clue. Some muscles, like your hamstrings, they actually cross over two joints. Think of them like a rope that has to work over two pulleys. Sometimes that rope gets so bunched up on one end that it can't really pull hard. We call that active insufficiency. Other times the rope is stretched so tight over both pulleys that it physically can't get any longer, which limits your motion. That's passive insufficiency. Understanding this difference is absolutely key to not misreading the evidence.
Okay, so our detective understands the language of muscles. Now they need a way to classify the evidence they find. How strong is strong? How weak is weak? That is where the official strength scale comes into play. This scale is basically the universal code. A grade 5 is normal. You can move through your full range of motion and hold strong against max resistance. Now, a grade 3, or fair, is a really important benchmark. It means you can do the whole movement against gravity, but with zero added resistance. Anything below that, like a grade 2, means the muscle can only move if you take gravity out of the picture. And at the very bottom, a grade 0, well, that means no contraction at all.
But here is a super important detail. This scale is all about rank. It's not a precise measurement. So a grade 4 is for sure stronger than a grade 2, but that doesn't mean it's twice as strong. Think of it like a race podium. You know who got first, second, and third, but you don't know their exact finishing times. It's a quality check, not a quantity check.
All right, we've got our tools, we've got our code book. It is time to see how the detective actually conducts the investigation, step by step. So, the investigation follows this really careful procedure. First, the therapist explains everything, even demonstrates the movement, so there's no confusion. Then, they get the patient into the perfect position to isolate the muscle they're looking at. But it's these last two steps, stabilization and resistance, that's where the real interrogation starts. The hand that's closer to the center of the body, the proximal hand, it plays such a critical role. Its job is to stabilize everything, to lock down the area. This basically stops any accomplice muscles from jumping in to help out, which means the suspect muscle is totally isolated and has to answer the questions all by itself. Now, with the area totally secured, the other hand, the distal hand, comes in and applies the pressure. It pushes against the muscle's line of pull to see just how much force it can really generate, and most importantly, hold. This is it. This is the moment of truth in the investigation.
But, the body is clever. If one muscle is weak, others will absolutely try to step in and compensate. So a good therapist is always on the lookout for these so-called trick movements or substitutions. Catching these is the key to getting a real, accurate diagnosis and not getting fooled by a clever accomplice.
So after gathering all the clues, watching all the movements, and grading the strength, it's finally time. Time to put it all together and crack the case. But look, the final verdict isn't just some number on a scale. A true detective has to consider all the variables. A person's age, their sex, even just how tired they are can change the outcome. What might be a good grade 4 for a pro athlete could be considered a normal grade 5 for someone who works at a desk all day. In this line of work, context is absolutely everything. And you have to know, this tool isn't perfect for every single case. For patients with certain neurological conditions that affect their muscle tone, or for really little kids who can't follow the instructions, the results can be pretty misleading. A good detective knows when their methods don't fit the crime and when they need to pick a different approach.
So, you see, MMT is so much more than just a test of raw strength. It's a way of listening to the body, of decoding its hidden messages. It really does turn a therapist into a kind of muscle detective, uncovering these secret stories of injury and recovery. So maybe the next time you feel a little twinge or a weakness, ask yourself, what story is your body trying to tell you?